Interventional radiology involves the usage of image guidance to perform minimally invasive surgeries. My name is Abner Mercado. I'm one of the IER fellows here at Miami Vascular. Our mornings will start with us reading up on our patients for the day and looking for any new updates from our previous ones.
Before our morning conference, we'll round on our patients to check in with how they're doing and talk about their upcoming procedure. In morning conference, we go over each of our patients and their imaging with our attendings. For my morning case, I had a patient with a lumbar vertebral compression fracture. For these patients, we can do what's called a balloon kyphoplasty. So using live imaging, I placed my cannulas within the fracture, then I put a balloon through the cannula, inflated it, and then injected cement mixture to open up the space, which provided a new stability with increasing the vertebral body heights.
For my first case of the day, I had a patient with extensive iliofemoral thrombosis, which extended into inferior vena cava. Our plan was to place a protection sheath in the IVC coming from above the clot, and then use a thrombectomy device coming from below. As you can see from the video, that we could access into the internal jugular vein to set up that filter. Then we came from below and we went through the femoral vein. The thrombectomy device we used is called a clot trigger device, and it basically acts as a mesh that we can open and close. And we use that once we're in the vessel at the level of the clot. You can see it open on the fluoro, and it's basically a big cage that will trap the clot. When we remove this, then the clot trigger, you have to whip it against a towel to get all the clot out. And this entire technique is done a few times in order to remove all the clot within the vein. And then we checked our results by doing a venogram, which shows us good flow. And at the end, you can see this model that shows here where all the clot was.
Around noon, we got a nice lunch break and grabbed some food from the cafeteria downstairs. My next case involved a patient with prior history of dizziness and prior carotid endarterectomies. Her carotid Dopplers were concerning for restenosis in the internal carotid artery, so we took her for an angiogram. We got right common femoral artery access, went up to the arch. We did some runs and actually found that she had severe stenosis of her brachiocephalic artery. And her carotid arteries looked fine, so we treated the brachiocephalic stenosis with balloon angioplasty and stent placement and did some runs through the carotids to make sure that we were not missing anything else, but overall, the case was great.
Peripheral arterial disease is a common vascular condition and happens when patients have reduced blood flow to their extremities, and they may develop wounds or necrosis that can require amputation. Some of what we can offer for these patients includes angioplasty and stenting, in addition to other procedures. So what you will see here is that we will inject contrast at different points proximally to see how the blood flows distally, and this in turn will help us identify an area with decreased blood flow. We can navigate our wires there, and we can do balloon angioplasty, for instance. In some instances, we could place stents, but for this patient, we just inflated the balloon in the left anterior tibial and the peroneal, and you can see the before and after effect it had on the blood flow to their foot.
So today was my CT day, and I did all of the CT guided procedures. This here was an ablation that we did. We used a new technology called a pulse electric field ablation, where we have one probe go to this metastatic deposit. We use a CT to line it up and go exactly where we needed it to, make sure the ablation zone's covered where we needed to go. And we did 5 treatments for this small metastatic deposit from rectal carcinoma. We're waiting to see how everything goes, but hopefully you'll have a good experience and we'll follow up tomorrow.
What are your hopes for the future of interventional radiology?
So my hopes for interventional radiology would be that we only expand into the fields that we're interacting with. We collaborate with a lot of different subspecialties currently, but I can only see that growing in the future. On top of that, I would love to see more diversity in the field itself, definitely within women in IR and all those different types.
I hope that IR will become a field where we're able to reach more patients, from just in the community, and so that people know what IR is, what we're able to offer.
What I want for interventional radiology is for it to be a more clinical specialty. I want to be able to take new consults that are undifferentiated and be able to actually, manage that patient based on a problem instead of trying to solve a condition that someone else has been managing. So I feel in order to do that, we need to be more clinical. We need to be more in tune with what's going on with patients before our procedures and after. And I hope that that's what the future entails for it.
What do you recommend to medical students who are interested in interventional radiology?
I would recommend anybody that's interested in interventional radiology to go and seek out the SIR Medical Student Group. It's a great resource. The IR community is pretty tight, so it's easy to find mentors and people you can reach out to. There's always great advice, and sometimes you can find opportunities to get a good mentor and shadow them if you can, and see what they do day to day. That's always a great thing to do.
Do as many away rotations as early as possible. You want to get exposure to different IR departments so that you can see that what each department does. Not everyone does everything, and you have a very broad field. And you definitely want to get exposure. And I also would recommend them to try to attend as many conferences as possible. Try to go to SIR, try to come to ISET or CIO that we run here in Miami at Miami Vascular Institute. I think that the connections that you make in conferences and the people you get to meet, it's really invaluable. That's all.